everybody, so I'm Loretta from Erasable Inc. And I had a lot of people ask me what type of syringes I use for my Botox. And I went through several different iterations of syringes before I decided on one in particular that I seem to like a lot, actually two that I like a lot. And so I'm going to start with the one that I originally picked out, and these are from Walgreens. And you can see that they're just regular insulin syringes. So basically it holds 1 ml and 100 units in it. I don't love these for a couple of reasons. The first is that with the very first injection, your needle is going to dull. Can you see that right there? Yeah. The needle dulls really fast, and so you really can't get more than one injection, and the patient's really uncomfortable. The other thing is when you look at the graduated elements of the syringe, it's really hard to get just a teeny tiny amount in there because it really holds 1 entire mil in there. And if you're just doing a 2-to-1 reconstitution or even a 2.5, it's really hard to just push a tiny little bit in there. So these are the Walgreens regular insulin syringes, not my favorite, okay? But they are really very cheap. The next set I'm gonna show you is from BD. So BD makes these insulin syringes, and I actually like BD as a brand a lot. The only thing is they're more expensive than most insulin syringes. And so this one in particular, so you can see here it is a 0.3. So what you're gonna get is 1/3 of a mil in here, which means that when you go to push your Botox in and you have a low reconstitution rate because you're not trying to put a lot of fluid underneath the skin, then you're going to, your little graduated elements are a little bit easier to control. So sometimes I'll do 1 unit for an eyebrow lift or 1 unit to do a little bit of the lip flip, and that makes it a lot easier. And this needle actually does really very well, and you can get probably 3 or 4 injections out of it before it's uncomfortable. I'm gonna bend down. What I will show you here is that this is, hopefully you can see it, maybe we'll put it against my hair. So this is a 1/2 inch needle. It's a little bit longer than what I would like for regular Botox, so I reserve this 1/2 inch needle for masseter injections because the masseter is a deep injection. And it's a deep muscle, you're going deep IM into the masseter, and having that slightly longer needle is easier to get that depth, okay? So this is the BD syringe, and this is what they call the 5/16 needle. So BD syringe, 0.3. I'm gonna bend down so we can see me better. 0.3, huh? Yes, a stool. She's gonna give me a stool to sit on. So 0.3 mils again, but this is a 5/16 needle. So you can see that it's a shorter needle. So this is fantastic for doing the frontalis or the glabellar or your corrugators. It's the perfect depth for that. A little bit far away, but that's okay, we'll make it work. And then, so I was saying that the BD syringes are a little bit more on the expensive side. That's perfect, thank you. So I order mine through Henry Schein, and they range between like $50 for 100 or so. Yeah, like $56. Sometimes it goes up and down. If you try to order them on Amazon, sometimes they'll be cheaper, and then sometimes they're 3 times more expensive. It just depends on, I guess, what Amazon has in stock. And then I recently found a supplier who does offer them for the cheapest price that I've found them for. She's fantastic. Her name is Kathy. I'm going to try to get you that info. But she is a great resource for finding supplies that are quality supplies at a cheaper price than you would get from your McKesson or your Henry Schein. The last syringe that I'm going to show you are the most recent syringes, and Kathy had suggested these to me. This is called the Easy Touch. And this runs about $25 to $30 for 100. And they are a 31 gauge needle, and it's a 5/16, so just like the other BD ones that I had showed you. And it's 0.3. So what that means is that when you go to inject, you're going to be able to control exactly how much you stick in there. I can even do 1.5 units of Botox with a 1-to-1 reconstitution and get really precise with it. It's called Easy Touch because it pushes really very easily. I do find with the BD syringes that you have to really kind of like give it some pressure to get it to go into the skin, whereas with the Easy Touch, you just give it a little tap and it just easily goes in. So I'm going to show you the needle here. Oh, can you see that? There we go. So there's the needle, and I really like these a lot. They're cheaper, and I have found them to be really just as good as the BD syringes, and the comfort level for the patients are really very good. So say for instance I'm doing the Proceris and the corrugators, I can probably get 3 injections out of that, and one is a deep IM and the other is kind of like at a 45-degree angle, and they're still relatively comfortable with that. I usually won't do more than 4 injection points with one syringe just because it starts to get uncomfortable, and you want your patients to not come back just because it hurts. So I think I've got some information for the place that I've been ordering my syringes from recently. I previously did it from Henry Schein, but I found a cheaper place, so it's called Merit Healthcare International. Good. And the representative that I've been using, her name is Kathy Gwynn, and she's fantastic. I really like her a lot. She's super helpful, and she will sometimes send me samples of different things. She'll tell me, oh, Loretta, you know, I'll order that for you. However, I want you to give this a try because it's cheaper and it works just as well, and she'll send me a sample or 2 of that. And for the most part, I've liked the things that she's sent to me. They are limited on what they offer. It's probably the more common things that you're going to use in your office. If you're looking for something that's really kind of unusual, she may or may not have it. I know that we had a recent lidocaine shortage, and I was able to get 7 bottles from her relatively quickly when Henry Schein and McKesson and even our local pharmacies were out. So there's the information on the insulin syringes. I hope that was helpful. You're more than welcome to write to me or ask me questions, private message me, or make a little comment and I'll try to reply. So here again is the information for Merit Pharmaceuticals. I'm not advertising for them, just showing you what I have used in the past and has worked well for me. All right, that's Loretta from Erasable Inc. Thanks.